Have you noticed that things don't feel quite the same as they used to, but you can't quite explain why? Not pain, not complete loss of function, just less sensation, duller, slower, less responsive. And here's the unsettling part: you probably didn't notice when it started. It crept in quietly. My name is Victoria Bashford, urologist, and in this video, we're going to uncover the hidden reasons why penile sensitivity can decrease with age, what your body may be trying to tell you, and what you can start doing, even tonight, to gently support improvement. If you find this helpful, consider liking and subscribing, because small knowledge shifts can make a real difference. And stay with me, because one of the most overlooked causes, almost no one talks about it, will come up shortly. Let's start with something simple, but surprisingly powerful: blood flow. Imagine trying to feel something through a thick glove. That's what reduced circulation can do. As you get older, blood vessels can become less flexible, narrower, slower. And when less blood reaches the penile tissue, sensation can fade. Not disappear, but soften. Here's the catch: this often happens before more obvious symptoms like erectile difficulty. So your body may be giving you an early signal. Quiet, but important. A quick question for you. Have you noticed colder feet or slower healing from small cuts? That can sometimes point in the same direction. And in a moment, I'll show you a very simple daily habit that may support better circulation without anything complicated. But before that, there's another layer: nerve sensitivity. The penis is rich in nerve endings, tiny messengers carrying signals to your brain. Over time, these nerves can become less responsive. Not damaged in a dramatic way, just less sharp. This can be influenced by things like long-term blood sugar imbalance. Even mild elevations over years can subtly affect nerve function. You might not have a diagnosis, you might feel fine, but the nerves can still be under strain. Here's a small test you can try later. Not now, just keep it in mind. Light touch versus firm touch. If the difference feels less clear than it used to, that's a clue worth paying attention to. And don't worry, we'll tie this into a simple plan shortly. Now, let's talk about something that surprises many men: friction habits. Yes, the way stimulation happens over the years can actually condition your sensitivity. If the pressure has consistently been high, fast, or very specific, your body can adapt. It's efficient like that. But the downside? Natural sensitivity may feel reduced in comparison. Think of it like listening to very loud music for years. Quiet sounds start to feel almost non-existent. This isn't damage, it's adaptation. And adaptation can be gently reversed. I'll explain how in a minute, because this is one of the most actionable areas. But here's where it gets even more interesting: hormones. Testosterone plays a role not just in desire, but in tissue health and nerve responsiveness. As levels gradually decline with age, you may notice changes that feel subtle at first: less intensity, slower arousal, reduced sensitivity. Not dramatic, just different. And many men assume it's just aging. But here's the truth: aging is not one single process. It's a combination of small changes, many of which can be influenced. Be honest with yourself for a moment. Has your energy changed? Your motivation? Those can sometimes sit alongside what's happening here. And shortly, I'll connect this into a very practical weekly routine. Now, let me bring in something often ignored: skin changes. The penile skin, especially the glands, can become drier or less elastic over time. This can reduce how sensations are perceived. If you've ever had dry hands in winter, you know how touch feels different, slightly muted. The same principle applies. Hydration, both internal and external, matters more than most people realize. And no, this doesn't mean anything complicated or expensive. We'll keep it simple. Let's pause for a quick myth check. Many people think reduced sensitivity means something is broken. That's not usually the case. In most situations, it's a combination of small, reversible influences. Think of it like a dimmer switch, not an on-off switch. And dimmers can often be adjusted. Now, remember I mentioned an overlooked cause? Here it is: medications. Certain common medicines, especially those used for blood pressure, mood, or sleep, can subtly affect nerve signaling or blood flow. Not always dramatically, just enough to change how things feel. This doesn't mean you should stop anything, absolutely not, but it does mean it's worth being aware. If you've started a medication in the past few years and noticed a change, that's a conversation worth having with your doctor. Quiet clues like this matter. Let's shift to something practical. What can you actually do? Start with movement. Not intense exercise, just consistent movement. Walking, light cycling, anything that encourages blood flow. Even 20 to 30 minutes most days can help support vascular health. Think of it as gently waking up the system. And here's your micro challenge. Tomorrow, go for a brisk 20-minute walk and notice how your body feels afterwards. Energy, warmth, even mood. These are connected. Next, vary stimulation. If habits have become very specific over time, changing the pattern can help retrain sensitivity. Slower, lighter, more varied. This isn't about performance. It's about reintroducing your nervous system to a broader range of sensations. It may feel different at first, less intense, but over time, many men notice a gradual return of responsiveness. Patience is key here. Hydration and skincare. Simple, but effective. Staying well hydrated supports tissue health, and if dryness is an issue, a gentle, non-irritating moisturizer designed for sensitive skin can help maintain elasticity. Nothing harsh, nothing perfumed. Keep it minimal. Now, let's touch on blood sugar, briefly but importantly. Even if you've never been told you have diabetes, keeping blood sugar stable supports nerve health. This means reducing excessive sugar intake, balancing meals with protein and fiber, and avoiding large spikes. You don't need a perfect diet, just a more stable one. And in a few minutes, I'll summarize this into a very simple 7-day reset you can try. Hormones. If you suspect low testosterone, symptoms often come as a group. Lower energy, reduced motivation, changes in sleep, and yes, changes in sexual function. If that resonates, a proper medical evaluation can clarify things. No guessing, no self-diagnosing, just clear information. Let me give you a quick scenario. Imagine two men, same age. One moves daily, eats relatively balanced meals, varies stimulation, and pays attention to his body's signals. The other sits most of the day, follows repetitive habits, and ignores subtle changes. Over time, their experiences diverge. Not overnight, gradually, quietly. That's how this works. Small inputs, repeated consistently, shape outcomes. Here's your simple 7-day reset I promised. Day 1. Increase your water intake slightly. Nothing extreme. Day 2. Add a 20-minute walk. Day 3. Focus on balanced meals. Protein, vegetables, fewer sugars. Day 4. Adjust stimulation. Slower, lighter, more varied. Day 5. Prioritize sleep. Aim for consistency. Day 6. Repeat movement and hydration. Day 7. Reflect. What feels different? Even small changes matter. This isn't a cure, it's a starting point. And many men notice subtle improvements within weeks, not days. Quick check-in. Are you expecting instant results? That's a trap. The body doesn't work like a switch. It responds to patterns, and patterns take time to shift. But the encouraging part? It does respond. Now, an important safety note. If you experience sudden loss of sensation, pain, or an erection lasting more than 4 hours, seek urgent medical attention. Those situations need immediate care. Most cases we're discussing here are gradual, not sudden. Before we wrap up, let's connect everything. Reduced sensitivity is often not one single cause. It's circulation, nerves, habits, hormones, and lifestyle, layered together. Which means improvement also comes from small changes layered together. No extremes, no quick fixes, just consistent, realistic steps. And here's your final thought. This isn't just about sensitivity. It's about listening to your body earlier, before louder problems appear. What feels like a minor change today can be valuable information. If this video gave you clarity, share it with someone who might quietly be wondering the same thing. Subscribe for more straightforward, practical health insights. And next time, we'll explore another silent signal your body might be sending. One most men completely miss until it's much harder to reverse. Take care.